everyone. I hope you're all having a wonderful evening. It's so great to see so many of you joining us from across the country. I just love watching that number climb when we start these webinars. So thanks so much for being here. We're thrilled to have you joining us for, I think, our first webinar of 2023, empowering you to take charge of your treatment. Our webinar tonight is brought to you by Zero Prostate Cancer in partnership with Dendreon. My name is Shelby Monier, Vice President of Patient Programs and Education here at Zero, and I'll be serving as our webinar host this evening. Before we jump in, I want to thank our featured speakers, Dr. Damian Sorce, Mr. Euvon Jones. Thanks so much for sharing your time and expertise and experiences with us tonight, and we will have a little bit more of an introduction in just one moment. So before we begin, I wanted to just go over a couple of housekeeping items. Our webinar this evening is being recorded. It will be posted on our website tomorrow, zerocancer.org. As soon as the webinar ends, you'll also see a link to a survey, and we would love for you to participate in that survey so we can get your feedback on this event. We also ask for topics for the future, so we can get some ideas of what additional topics we can help provide for you. Tomorrow, you'll also receive an email with a link to the recording for this webinar and that survey once again. So for those of you not already familiar with Zero, Zero is the leading national nonprofit with the mission to end prostate cancer and help all who are impacted. We advance research, provide support, and create solutions to achieve health equity to meet the most critical needs of our community. This is a fun slide of all of our very exciting logos. We got a new logo that launched at our Zero Summit in February. So we're thrilled to shorten our name to Zero Prostate Cancer from Zero, the end of prostate cancer. So really quickly, I just wanted to go over our amazing portfolio of patient support programs, educational tools, and various resources that are, of course, offered at no cost to patients and families. So if you are someone you know is in need of resources at any time during this prostate cancer diagnosis or journey, please, please, please share these resources, reach out to the Zero team, and just know that we are here to help and you're not going to go through this alone. So really quickly, I just want to highlight a couple of our programs. 036 you see here is our individualized case management program. We help patients and their families connect with trained case managers. They can assist with financial assistance program, enrollment, navigating insurance, finding other support, emotional support, transportation assistance, cost of living assistance, even psychosocial support. So wonderful comprehensive program. We also offer one-on-one peer support through both our mentor programs and then group peer-to-peer support through our Us2 support groups. So please take a look at our support group finder tool. It's a new tool on the Zero website, zerocancer.org, and you can hopefully find a group that's meeting near you. We also have many groups who are meeting virtually. So really anywhere throughout the country and even outside of the United States, we have groups available to you so that you can connect with others. We also have a private Facebook group that allows folks to come together online. If you're already on Facebook, you might like that system. And we also have another online community called Inspire. So it's more than 30,000 patients and their loved ones who are online and ready to support one another as well. So we really have a well-balanced portfolio, and hopefully you can find something that really works for you. We're also thrilled this year to now host 50 nationwide run walks in 2023. And the Zero Run Walk program is the largest men's health walk series in the country. And we would just love for you to join our movement to zero out prostate cancer in a city hopefully very near you. And you can find the list and the dates at zeroprostatecancerrun.org. We'll also drop these links in the chat feature in this webinar so you don't lose them. And another program that I'm thrilled to share with you is our Prostate Cancer in the Black Community film series. This is part of Zero's Black Men's Prostate Cancer Initiative. And these film series events are really public viewings of 3 different films that highlight and raise awareness about prostate cancer in the Black community. And we have another one, our next one coming up in May 20th. in Charleston, South Carolina, and registration is now open. Again, we'll drop these links in so that you have them. So today's webinar, as I mentioned, is led by Dr. Damian Sorce, a urologist at Colorado Urology Associates. And I'm going to allow you to read the additional points in Dr. Sorce's bio, but he is here to talk to us about immunotherapy, generally speaking, Provenge, but also taking charge of your treatment. In the second half of our webinar, Dr. Sorce will be joined by Mr. Euvon Jones. Mr. Jones is a prostate cancer survivor who will be sharing his prostate cancer story with us. And then at the end, we'll be taking questions from our audience. So please feel free to drop those questions in the Q&A box at any time, and we're going to be gathering those, and we'll do our very best to get to as many questions as we possibly can and until the end. So with that, I will zip it and I will pass it off to Dr. Sorce to get us started.
Thank you. So my name is Damian Sorce. I'm a urologist in Denver. I do the advanced prostate cancer for our group, but prostate cancer is just not a job for me. It's pretty personal. My father actually has metastatic prostate cancer, and so this is a passion of mine. So hopefully today what I'm going to try to do is give you some information that maybe you didn't know before. And I'm really encouraging you to please ask any questions. Just put them in as I'm talking. Put them into the chat so we can get to them. If you have that question, you can rest assured there's dozens of other men out there who have that same question. Are going to appreciate you asking it. So with that, we're going to start. I don't have the little Shelby. I can't forward it. There it is. Okay. With that being said, let me go back. Sorry. I have to do this. This is a promotional program sponsored and paid for by Dendrian Pharmaceuticals. The information today is presented is required to be consistent with the FDA guidelines of the approved Provenge label. That being said, let's start. So what I want to start with is my assumption is almost everyone here is either a loved one or has prostate cancer. So what I'm hoping is that you will become an advocate for your disease, meaning you will go out to your community, tell your family, especially your brothers, your uncles, your father, if you're young, your sons, your friend group, to get their PSA checked. Zero does a great job with this. Doctors tell patients to do it, but nothing hits home as much as a patient with this disease actually telling their friend, please go get PSA checked, because the earlier you get it checked, the better. If we find prostate cancer, earlier is always better. And the reason it's so important to check is it is the most common cancer diagnosis in men. 1 out of every 8 men in the United States in their lifetime will be diagnosed with prostate cancer. Over 3 million men are just like you living in the United States right now with prostate cancer. I can't emphasize enough that living with prostate cancer, being diagnosed with prostate cancer is not a death sentence by any means. So one of the things that we're going to talk about is living with prostate cancer. We're going to get to that in a second. Oops. With the stats I just showed right here, this is for all men in the United States. For African-American men, it's actually much higher risk. Some of the slides on my side seem to be a little off, but African-American men are 1.7 times the risk of their life of getting prostate cancer compared to Caucasian men. They're twice the risk of having advanced disease, and they're 2.4 or almost 2.5 times the risk of dying of prostate cancer compared to Caucasian men. So please, any African Americans out there or friends with or patients who have African American friends, please get your PSA checked. Screening for, tell them to get their PSA checked. This is a much greater risk for African Americans than for Caucasians in the United States. Okay, don't pay attention to this slide. Pay attention to what I'm saying. I want to go brief background before we get into some of the weeds of advanced prostate cancer. So any cancer starts off localized. And you can see that on the left-hand side here. Over time, and how long it takes is very different in different people, but over time, localized disease will become metastatic. Some of you know what that means, some of you don't. Metastatic is a fancy medical term for meaning spread of cancer. So I hear this a lot. My father died of bone cancer. Well, actually, he probably didn't. He died probably of prostate cancer. That means cells that started in the prostate, moved to the bone, and it becomes metastatic prostate cancer. It doesn't become bone cancer. So over time, the cancer becomes localized, and then it'll become metastatic. When it becomes metastatic, that is when something called hormone therapy is usually initiated. Some of you may be on hormone therapy and know what it is, and some of you may not be. Hormone therapy, for those who don't know, is the exact opposite of what you think it is. We're not giving you a hormone, we're actually taking away a hormone, and that hormone is testosterone. Testosterone is the food that prostate cells, including prostate cancer cells, use to grow. And so by taking away that food, we can shrink the cancer. Over time, and this is all the way on the right-hand side of your screen, it can become advanced prostate cancer, which often means hormone resistant, meaning it's no longer responding to the hormones and it's starting to grow despite the treatment of hormones. And this is the group of patients we're actually going to talk about Provenge with, but that is sort of how it works: localized, metastatic, and then hormone-resistant prostate cancer. Okay, so one of the things I mentioned was living with prostate cancer. Remember, 3 million men in the United States are currently living with prostate cancer. And a prostate cancer, either at diagnosis or at progression of disease, causes lots of anxiety, depression, questioning your mortality. These are all completely normal thoughts when you're diagnosed with this or the disease progresses. What I want to stress is for patients to control that stress on themselves in healthy ways. You know, and how do you do that? You do that by eating healthy, losing weight, stop smoking. Most importantly, and men are pretty bad at this, my assumption is the men on this group are actually good because you're actually in a support group, but embrace your social networks. Number one on this list right here. Embrace your social networks. That is really probably the most important thing. The number one risk of dying when you have prostate cancer is not prostate cancer. It's actually heart disease. That's the number one killer of men, and it's the number one killer of men who have prostate cancer. And so by practicing, healthy eating habits, exercising, embracing your social networks, all those have been shown to reduce your stress and at the same time, reduce your risk of cardiovascular disease, which is going to lower your risk of death. What I always tell my patients, whatever is heart healthy is prostate healthy. So please learn to live with it, embrace your networks, eat healthy, stop smoking, and exercise. Those are the main things I tell every patient at every stage of their disease. Because the ultimate goal of any treatment plan is to live longer. And I would also add, live longer while maintaining your quality of life. So when you become advanced, there are tons of treatment options out there. We're not going to talk about all of them, but we're going to talk about Provenge. And Provenge is the only FDA-approved immunotherapy for this fancy word right here, mCRPC. And what does that mean? Well, M stands for metastatic, and I just talked about that, but to review, that means spread of the cancer outside the prostate. CRPC stands for castrate-resistant prostate cancer. Remember, castrate-resistant means when the cancer has broken through the hormone therapy you may be getting. So it's approved for men with castrate-resistant prostate cancer. That is metastatic. But what is immune therapy? And what is the immune system? Now, this part is probably a little easier than it was 3 years ago because the country has just been through COVID, and a lot of us are familiar now with what the immune system is. The immune system is made of a variety of cells that work together to basically differentiate self, like any cell that is my own, versus anything that is an other. An other could mean a bacteria, it could mean a virus, or it could mean cancer. And the immune system is constantly on the prowl looking for any cells that don't belong. And the reason cancer can develop is because it can avoid immune destruction. It learns to sort of pull a curtain around itself so that the immune system can't see it. Because constantly our immune system is fighting small cancers that develop, but just never get big enough, or the immune system just wipes them out before they get big enough for us to even notice. And we know this is true because when patients have a low immune system, for example, patients who are immunocompromised, their risks of different cancers go up dramatically. And you can see this in this slide. So remember, the immune system is designed to look for self versus other. In this patient population, there were patients who had transplants. So if I give my kidney to John, even though it's still a human kidney, John's immune system recognizes it as another, and it tries to fight it. So we have to give immune suppressing drugs to that patient so they can accept the kidney. And these are the patients that you see here. And when you do that, you see multiple different types of cancers goes up. So that means the immune system is constantly fighting the cancers in the background, and we don't even know about it. And the ones that develop are the ones that have learned to sort of pull the wool over the immune system's eyes so that it can't see it. And so there's this balance between the immune system's trying to escape, the cancer's trying to escape while the immune system's trying to find it. And unfortunately, prostate cancer does a really good job in hiding from the immune system. So what is immunotherapy? So these are these big words we use in medicine. Immunotherapy means just if you chunk it out, you can figure out what it means. It means a therapy of the immune system. So really what any immunotherapy is designed to do is to basically restore the ability for the immune system to see a particular cancer and then go after it. And this is where Provenge comes in. Provenge is a personalized immunotherapy. I can't emphasize that enough. It's not a pill. It's not something that if I needed it would be the same drug that Mr. Jones got 10 years ago, and he'll talk about that. It is a personalized, specifically for you treatment to sort of boost your immune system to fight prostate cancer. Not only is it personally made for you, each dose is specifically made for you. You know, and over 40,000 men have gotten this, and it's to show that it works. And to show that it works, and the FDA had to approve it by showing that people who get it, they live longer. And so this is the data that showed that patients who got it in the top live longer than patients who didn't get it. And this is data that's actually this is 15-year-old data approximately. You know, Provenge was approved in 2010. And so the patients that were used for this were all done a few years before that. So this is old data, but it basically shows that it works. And now there's newer data showing that it really works the earlier you give it. So it's hard to see, but if you look on the left-hand side, these are patients whose PSA was under 22 when they got it, compared to patients whose PSA was over 130 when they got it. And we can see that Provenge works a lot better the earlier you give it. And that's been confirmed with real-world study, which was a study of more than 2,000 men out in the community after Provenge got FDA approved. And it showed the earlier you gave Provenge, so these are patients whose PSA was under 5 compared to patients whose PSA is over 46. The earlier you give it, the longer you live. So we know it works. We know it makes you live longer. And it also works if we give it with the newer drugs out there. So again, this is real world data. These drugs, which they call in this slide ASPIs, these new drugs, which many of you may be on, include abiraterone, Xtandi, or Leta. There's 4 of them. These new drugs, if you give it with Provenge, you still live longer. So in multiple studies have been shown that this works. By activating your immune system against prostate cancer, people live longer. And if you guys go back and remember one of the first slides I had, it showed that prostate cancer is really prevalent in the African-American population. And not only was it more prevalent, but the risk of death was 2.5 times that compared to Caucasians. And this is one of the few medications out there that breaks out African-American and Caucasians and how well they did to a drug. And what you actually see is African-Americans respond really, really, really well to this medication compared to the average Caucasian. So what you have here on the left-hand side is if someone's PSA is under 30, the average African-American, if he got this drug, lived 54 months compared to 33 months with if you're a Caucasian. So this is the safety slide. I skipped over the first one, but they're telling me basically I have to do it once. So I'm going to just go over a few things here. The most important thing you need to know is it's an immunotherapy. So it's designed to get your immune system activated. And it's when your immune system is activated, it's basically like having a cold. And we all know what that's like. Chills, fever, back pain, nausea, joint aches, headaches. These are very common side effects, usually mild, with people getting Provenge. These side effects are a result of the activation of the immune system. So when you get a virus or a bacteria and you have these symptoms, it's actually, those symptoms are not due by the bacteria, they're due to your immune system. Just like here, these aren't side effects of your body to Provenge, but to your immune system, Provenge activating your immune system. So they're very common. And the good news is if you get these, you know you have an idea that your immune system is being activated. It is made from your own immune cells. We'll talk about the different cycles in a minute. And if you develop if you're getting the medication and you develop any of these serious side effects, you need to tell your doctor. And these will all be gone over with you in detail if you're actually getting the medication from your doctor. So how does the Provenge process work? This is really unique and really, this is a sort of as I said before, prostate cancer is sort of personal to me. I am a huge believer of Provenge. And one of the reasons is how unique the delivery, how unique of a drug it is. So Provenge is given in a total of 3 cycles. So within 1 month's time period, you'll be done. So it's a one-time commitment of a month, and then you're done with the drug. You move on to other treatment options. Each cycle of the 3 cycles requires 2 visits. So it's a total of 6 visits, you're done. The first visit, and day 1, is we collect your immune cells. So white blood cells, so your blood is made up of multiple different things, but to simplify it, white blood cells, immune system, red blood cells, those are the ones that deliver oxygen to the rest of your body. So day 1 is we collect less than 1% approximately of your white blood cells in your body. That's called leukapheresis. And we collect your white blood cells. These are then couriered to, I believe, 2 different sites that Provenge currently has. I'm in Denver, so ours are couriered to California and Seal Beach. In this laboratory, your white blood cells are basically exposed to specific parts of prostate cancer and then activated. And the end result is when the process is done in the lab, these are immune system cells that are ready to run through a wall and find prostate cancer and destroy it. They are all hyped up. Where's the prostate cancer? I want to find it. So these are then couriered back to, for my case, to Denver, into my office, where we then dose it into the patient. And these have a very short expiration time. These are literally couriered on planes and then put in special cars brought to your office, and they have a very short time period of when they can actually be infused back into you. And that is done a total of 3 times. So the first dose would be, the first time is 2 doses, 2 weeks later, 2 doses, 2 weeks later, 2 visits. So a total of 3 doses of Provenge, a total of 6 visits. The first step, but when your doctor says you qualify, would be a vein assessment. So the first step, as I said, was the leukapheresis. Leukapheresis, fancy word for taking out some of your white blood cells. It's about a 3 or 4 hour process where you basically lie down. You have 2 IVs in you. Your blood is drawn out. It's put into a special machine. Very small percentage of your white blood cells are removed. The rest, including your red blood cells, are then put back into you. That takes about 3 or 4 hours. A vein assessment is designed to see if you have good veins to be able to do that. Not to worry, if you don't have good veins, there are other ways around it. So then you get your leukapheresis, and then you go home. A few days later, you come back to the doctor's office and you get your infusion. Your infusion is much quicker. It's about a 30-minute infusion. We usually watch you for about 10 to 30 minutes after that to make sure you're okay. During that time, we give you some medications to help with some of the side effects. So when you're at home, you have a fever, you take Tylenol. So we tell you to take Tylenol. We can also tell you to take an antihistamine, something like Benadryl, but Benadryl actually makes you really tired. So I'm not a big fan of Benadryl. And then you go home and you do this 2 weeks later, and then you do it 2 weeks later, and then you're done. It's a highly coordinated process between your office, the leukapheresis site, and also Dendreon. Remember, each specific batch is made specifically for you on a specific date. So this is not a pill they can just pick off the shelf and give to you. So it's highly regulated of when your dates are, and Dendreon and your doctor's office are going to coordinate that for you. So is the treatment right for you? Remember, it's FDA approved for metastatic castrate-resistant prostate cancer. In layman's terms, prostate cancer that has spread and that is no longer responding to hormone therapy. And how you get there is different for different people. And that's what all these little men here and the story underneath them are, but how they get there is different. But if you have that, you're relatively healthy, meaning you still have a decent immune system that we can activate, and you're not on narcotics for bone-related pain. So you can be on narcotics for chronic back pain related to osteoarthritis. That's not a problem, but you can't be on narcotics for bone-related pain or cancer-related pain and get this medication. So you have to be castrate-resistant, you have to be metastatic, and you have to be relatively healthy and not on narcotics for your cancer. The vast majority of men that I treat currently in my clinic are men whose PSAs are under 5. So vast majority of them meet this criteria. Back in 10 years ago, it was very common to see men whose PSA, because we didn't have a lot back then, it was very common to see men who did have a lot of bone pain because they're way further advanced. Remember, catching it earlier at any stage of the disease, at diagnosis or when it first becomes metastatic or when it first becomes castrate resistant, is always a benefit to you. So as long as you meet those criteria, you qualify. My assumption is many of the men here already take charge of their cancer and of their health, and that's why they're here at this meeting. But that is an assumption. I don't like making many assumptions. So what I would like to say is, if you feel like you qualify for this or you're unsure, ask your doctor, please. Ask your doctor. It can't hurt from asking, hey, I learned about this Provenge. Do I qualify? Worst comes to worst, you say no. So it's not, if you're unsure, ask either your oncologist or your urologist, depending who's taking care of you. The other thing I hear a lot from patients is insurance coverage and financial information worries. We're in a hard time right now. The economy's not doing great. Medications cost a lot. I just want to rest assure everyone here, Dendreon and your doctor are going to do everything they can to make sure that you can afford this drug. And what that means by afford is different for everybody. But no matter how little afford means, and it means $0 is what I can afford, there's ways to get you there. There are multiple insurance coverage is universal. If you don't have insurance, there's programs. If you're underinsured, meaning insurance says they'll cover it, but you owe a big deductible, there are grant programs out there. There are foundations out there. There are multiple ways to get you the drugs that you need. So please do not let this be a barrier to asking about this and going through. So what I'm hoping from today, you can come away with 3 things. 1, be an advocate for prostate cancer. Tell your family, friends, especially and loved ones who are over 40, get their PSA checked. 2, learn to live with prostate cancer. Remember, the #1 risk of dying of prostate cancer is heart disease. Eat healthy, exercise, and really, men aren't good at this, embrace your social networks. And the last thing is, if you do have metastatic prostate cancer, it's becoming castrate resistant, please make sure you talk to your doctor about Provenge and immunotherapy. It works different than any drug out there. It's specifically made for you, and it only requires 3 treatments, total 6 visits, 3 treatment doses over a period of a month, and you're done with it. So those are 3 things I want you to come away with. Please ask questions. Please ask questions. Please ask questions. And I'm hoping that you got something out of the slides we just did. And I'm hoping that you get something out of the question and answer. I know you're going to get something out of hearing from a patient who's actually been through this process, Mr. Jones, and he is next.
My name is Euvon Jones, and I'm here to make music. Well, I'm really here to talk to you about my journey with prostate cancer, but I believe I'm on the planet to make music. I grew up loving and playing music, and it remains a cornerstone of my family's happiness. And I love it because music celebrates life and the human experience in ways we can feel, understand, and keep with us throughout our lives. I was diagnosed with mCRPC 12 years ago. And while Dendrian is compensating me for being here, I hope my story will encourage you to advocate for yourself, no matter where you are in your journey with prostate cancer. Please remember that what I share with you today is my unique experience. Yours may be different. I was born and raised in Baltimore, Maryland. My wife, Janet, was too. My concentration in math and music led to a full ride scholarship at Delaware State, and of which I didn't take. I went to work as a musician and a tradesman. I never planned on working in a steel plant, but life is full of a bunch of plot twists. And I ended up becoming a unionized sheet metal worker while playing bass in an R&B band. We eventually started opening for some major acts like Smokey Robinson and the Miracles, the Commodores, Earth, Wind & Fire. It was a wonderful time. My wife and I met in another band where I ended up cultivating a relationship. And after an interesting courtship, and the emphasis is on interesting, we finally married. Years later, in 2011, I developed a limp that made me think I had hip problems. It was sudden. I was working outside, took a normal step and experienced the shooting pain. I tried to dismiss it for as long as I could, but eventually I went to an orthopedic surgeon. He took some x-rays, gave me ibuprofen for the next 9 months. I didn't think the discomfort was too out of the ordinary, and I could still work. So I wrote it off as just getting older. And then 3 months later, I was swimming and challenged a young boy to a race. I beat him the first time in the pool. He beat me the second time. So the third time, I proclaimed right there and to the whole universe that no young boy would beat me across that pool again. I went underwater and powered through like a shark. I won, but I could hardly get out of bed the next day. My whole body ached in a way I never felt it before. But again, I thought it was just me getting old. I was 59 years old. I went back to the orthopedic surgeon and he ran an MRI. When I got the MRI, the technician was so alarmed at what he saw that he faxed my results to my doctor. I ended up with another appointment that afternoon, right after work, with an oncologist. My initial suspicion was multiple myeloma, but the lab results for my blood and urine suggested prostate cancer. Confirmation required a biopsy, so they took a bone marrow and prostate samples, which was a challenging and painful experience for me. It also confirmed my diagnosis of stage 4 prostate cancer. The oncologist who confirmed the news is still my oncologist today. I asked how many more stages were there, and her answer took the air out of the room. So as you can see, I didn't know much about cancer. Things were quiet, muffled. It was hard to breathe. I felt like I was sealed in a mason jar. I'm glad my wife Janet was there because I couldn't put anything together. Sometimes people ask me about the first thing I did or wanted to do after diagnosis, but I didn't have a list. I didn't even feel like I had a purpose. The stage 4 cancer diagnosis made me feel like my time was already up. It was hard to structure or feel connected to anything. There was no plan. I simply looked at Janet and said, I need a martini. And I don't even drink. We told our children later that same day, which was tough, but it also did a lot to get me focused, to get my affairs in order. Beyond that, it took another 3 or 4 weeks to tell the extended family. I wasn't given a long or lengthy prognosis. So for New Year's Eve, Janet threw me an epic party. Everyone was there. Sort of like the function and the junction. We had a ball. And while we knew my situation wasn't great, we ended the evening with a new resolve to fight as hard as we could. I had an uncle diagnosed with prostate cancer, so it was nice to have someone to talk to. But overall, Janet is always my most prominent support person. She's done everything she can to learn about prostate cancer, transform our lives, to support my situation, actually becoming a student of my diagnosis. I should take a minute here and highlight how vital education is, not only to ourselves, but to our communities. Knowledge is essential to have, and I've been grateful to receive it sometimes from places you wouldn't expect. For example, there are times that Janet might be shopping at a deli counter and I can only eat certain foods that, because of my diagnosis, and other men with similar experience often suggest foods that may help. And I'd say that being diagnosed with cancer has undoubtedly deepened my sense of community and taught me that support could come from anywhere. My doctors started me on a testosterone blocker. Even though I was advanced and that mCRPC, or metastatic castrate-resistant prostate cancer, from the very beginning, the MRI showed us that much anyway. I was also placed on bone medication to hedge against osteoporosis and received a hormone therapy shot every 3 months. There weren't many other choices at the time because my cancer showed such a wide metastatic spread. I wasn't eligible for chemo, radiation, or surgery. My doctors monitored my PSA, testosterone, and other markers with blood tests, and these treatments worked well for a little over a year. And my PSA numbers dropped tremendously, but eventually they started to rise again. And that's when my doctor mentioned Provenge. I didn't even know what Provenge was, so she gave me some homework, small stack of information regarding clinical trial. We took it home, studied it the best we could, and we watched a video explaining the treatment process, which was very useful. We were encouraged that Provenge was shown to extend life for certain men with mCRPC. And the treatment schedule fit my work and home life. We didn't have any questions or concern about side effects. We trusted our doctor and were eager to move forward. I received my Provenge treatment in 3 cycles, as the doctor has talked to you before. Each cycle took a week with a week off in between. We began in February 2013, and all 3 cycles were finished by April 1st. I didn't recognize that I needed a vein assessment. So at that early stage, I had a problem when the phlebotomist had such a tough time that I ended up with ports for leukapheresis. And these ports were basically placed in my chest. Leukapheresis is a cell collection process, and my blood was passed through a machine that extracts an amount of my immune cells along with some platelets and red blood cells, and the remainder of the blood was returned to my body. And we sort of make a joke of the leukapheresis process with the centrifuges shaking the blood down. The blood was returned to my body, and the extracted cells were sent to a manufacturing facility where my cells were used to make my personalized dose of Provenge. Provenge is a personalized immunotherapy made from your own immune cells that empower your body's immune system to recognize and attack your prostate cancer. Janet went with me for the first time, but the process was manageable, so I did the rest of the appointments alone. Also started at 7 a.m., so it wouldn't impact my workday, and each appointment lasted around 3 hours, and I passed the time easily enough with a book, or I'd read some scriptures to keep myself motivated. I didn't have much special preparation for those appointments, but we were always sure to visit the hospital during the off weeks, because the important part was my ports were sanitized every Monday, Wednesday, and Friday. I occasionally experienced chills in the process of the leukapheresis process, which is a common side effect of Provenge. And other side effects, as we've said before, include fatigue, fever, back pain, nausea, joint ache, and headache. And of those, I didn't have any. And I'm happy to say that I responded very well to treatment. I received Provenge in 2013, and since, my PSA remains very low. My testosterone levels are down, and my immune system has the strength it needs to keep up the fight. So today, we try to do everything around our faith and family. Our 4 kids are grown now, and we have 6 grandchildren, and they're all pursuing their dreams. Our children are involved in the arts and the sports. We love to travel. We love to dance, play music, have a good time, party. We have such a great time sometimes at family gatherings. I think we should make our own playbills. I love having the opportunity to share my story. Janet has been amazing with her continuing research and chronicling our journey. I hope it can help you in some way also. I encourage all of you to keep a record of your experience. It's a wonderful way to process and to keep moving forward. It's also medicinal because it'll make you talk. For those living with a diagnosis, I encourage you to keep learning, find resources that educate you and help you advocate for yourself, and especially if you're newly diagnosed as metastatic. The Provenge website is a great place to start, but you shouldn't stop there. In fact, don't stop at all. Be proactive with your doctor to find a medication that works for you. So I want to thank all of you who have come online to listen to my story. I'm happy to answer any questions about my experience, but please direct any questions about Provenge to healthcare provider, Dr. Sorce. And in reference to a personal note, the reality for my diagnosis is my PSA originally was monitored at 398. And now, today, 10 years later, 12 years since being diagnosed as metastatic stage 4 prostate cancer, my PSA is 0.0. And I know that Provenge does not necessarily lower your PSA, but of the many men that were given an opportunity to have this drug, I'm more than 10 years out since receiving it. So even with the averages, I got a lot to be thankful for. And if God didn't step in, it'd just be another story. So the doctor and myself are open to any questions you might have.
Thank you so much. Thanks for showing those pictures as well. It's so warm and amazing to have you share your story and be so open and honest with everyone. And many of whom are complete strangers, but I know are friends now because you are able to share your story with us. So thank you so much. We're getting a lot of comments in the Q&A thanking you for your story and the wonderful presentation and testimony. So just want to extend that thanks to you. So I'm going to jump through some of the questions that came through and please both of you chime in, even if the question is, maybe more directed to Dr. Sorce or vice versa, because we really want to just keep this open and free flowing for the remaining 10 minutes that we have. So there seem to be a couple of questions, just generally speaking, Dr. Sorce, about Provenge and its availability for patients before the prostate cancer becomes metastatic. And we all know what the FDA approval is for. But if you could shed just maybe a little bit of light on that, I think that would be helpful for a handful of our questions.
So currently it is only available and FDA approved for metastatic castrate-resistant prostate cancer in mildly symptomatic men. So, the official definition of mildly symptomatic again means not being on narcotics for cancer-related pain. There are studies out there, none of them have been published and no results are available for other parts of the disease, including active surveillance is the one I personally know about. I think there's a few other smaller ones out there. No data on any of that has been made public. This is speaking for myself. If I like to joke, I'd put it in the water if I could. Because obviously you can't because it's personalized. But my dad, as I said, my dad. So he was diagnosed in 2012-ish too with metastatic prostate cancer after radical prostatectomy. But he's been sensitive to hormones for over 10 years now. So he's just been on hormone therapy. If I could, I would give him this drug. But I can't because it is very, 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 I mean, if you wanted to pay cash, you could, but one, it's very, very expensive. And two, there actually is no data showing that it would help in an earlier disease state. So, unfortunately, that's where we're at. With times, things change. I can give you a little detail, and basically how it works is for those out there, and this is frustrating as patients and for the community. It's frustrating for physicians also. Most physicians write drugs and will use drugs off FDA label. So the vast majority of medications out there that you're getting may not be, quote, FDA approved for what you're getting it for. But this is a very expensive drug, and so insurance companies have used the FDA label as a roadblock. That being said, there is no data. There's zero data at this point that earlier is better. Oh, I didn't get myself into trouble by saying that, but that's unfortunately where we're at. That being said, make sure that you are regularly getting your PSA and the testosterone checked, and you not only that, and I see this a lot, you're regularly getting imaging. So if you are you have castrate, you're metastatic and you're castrate sensitive, you're either getting Orgovyx or you're getting Lupron shot. So you're getting that. You may also be getting another pill. But every 3 months, you should be getting a PSA and a testosterone. And you should also, every year or two, be getting either a bone scan, CAT scan, or PSMA scan. And the reason for that is sometimes prostate cancer can start growing and your PSA doesn't change. So you can become castrate resistant with a PSA that is flat normal, like 0. And that can only be caught through imaging. And I see second opinions constantly where their doctors are not getting regular bone scans and CAT scans if their PSA doesn't change. And I have to be blunt. My dad lives in New York City. He's at a very famous place with a very famous oncologist taking care of him. And every 2 years, I have to get on the phone and call the oncologist and be like, why haven't you ordered something? This, all right. So this is normal that it doesn't happen. So again, be an advocate for yourself.
Yeah, great message. I have one more question, Dr. Sorce, for you, and then a question for Mr. Jones. Are there any treatments? We have a couple specific questions. So just to our listeners, we're going to try to do our best to remove some of the very specific pieces of the questions to answer them. But are there any treatments that would rule Provenge out for a patient? So one person is asking about a former prostatectomy. One patient is currently doing chemotherapy and is wondering what that might mean for
there is nothing. Yeah, there's no previous treatments that are going to rule you out. So there was that slide, I sort of glossed over it. There was all those men. Each of those men had a different story, how they got to qualify for prostate cancer. It doesn't matter how you get there. That's why I sort of briefed over that slide. It doesn't matter how you get there because there's a million different ways. And there was, I think, like 7 men there. There's more than 7 ways you can get there. Okay. So the key is, as long as you have metastatic castrate-resistant prostate cancer. So let me just give a quick example. Someone got a prostatectomy 20 years ago, and their lymph nodes were positive. Okay, at the prostatectomy, that's metastatic disease. 20 years later, they become castrate-resistant. They get a scan and it doesn't show any disease. They can't find where the disease is. Doesn't matter. You're still metastatic, castrate resistant. You're metastatic. Once you're metastatic, you're always metastatic.
Yes.
If you've had radiation, the same thing. Doesn't matter how you get there, as long as you're metastatic, castrate resistant. No previous treatment previous treatments, radiation, surgery, chemotherapy, oral oncolytics, radium. The list goes on and on. A PARP inhibitor. None of those disqualify you for getting this, as long as, again, you meet minimally symptomatic metastatic castrate resistant.
Yeah, thank you. And it's okay that you glossed over that slide. We covered it anyway.
Yeah.
The next question is for Mr. Jones. So this listener is just kind of wondering about your previous health habits before your diagnosis. You mentioned how healthy you eat now, taking care of your body, but this individual is wondering pre-diagnosis a little bit about your lifestyle, if you'd be willing to share your comfort level, of course.
I'm so comfortable in sharing that prior to being diagnosed, my lifestyle was, I was a human trash can. I ate what I wanted. I did what I wanted. I lived like I wanted. Oh my goodness. Lifestyle wise, myself and my partner, we had our own HVAC company. So I was an entrepreneur. I worked 12, 14 hours a day, 6 days a week. Sometimes started work at 3, 4 in the morning. And that thing that men love to do is you get your coffee and then you stand at the vending machine and you pull that vending machine to get your ho-hos, your Peter Paul Almond Joys, you get your paydays, you get those little snowballs, those pink things, and you get that sugar hit, not even knowing. And my wife and my kids were on organic foods. Our lifestyle in our home was totally different than what I lived. And I lived like that because I felt I was good. As the doctor said, I was that word they call asymptomatic. I never felt bad. And being owning basically a construction company, I could do administrative, procurement, project management, or I could go out in the field and work with my guys. I'd get recut. So I never thought I was sick. But after finding that out, because of my wife becoming a student of it, she put us on organic foods. She changed the environment in the home. We have air filtration on both levels of our home. We clean with rock gut, bottom shelf vodka and vinegar. We threw away contaminants such as ammonia and bleach. We basically took all the rugs out of the house. We changed the air quality. We started to change, and I use an analogy of wanting to change the seed, you have to change the soil. And that we became students of. So I believe that, and by the blessing of God, put me in a position to help my immune system be able to fight and to come all the way down with the PSA of 398 to 0.0. And my oncologist today said, you know, my cancerous lesions that went metastasized in my bone marrow and my lymph nodes were being replaced by new.
It's amazing. I wonder, you think about the way that Provenge works, and I think in the Black community, we talk a lot about trust and finding a provider that you trust and a treatment team that you trust, so that you can be an empowered patient. And but I wonder, for your experience, what was that part of this treatment decision like for you when you found out how Provenge worked, and you're going to have your blood sent off to somewhere and then brought back and put back into your body? Did that ever cross your mind, just the kind of knowing the history of our United States and the world, not just the United States, and having a healthcare system that we can all trust?
Wow. Well, given the opportunity where I sit now, it's amazing, because when you're going through something, you really don't focus as much as you think you should, even though you're studying that situation. But also having an oncologist who did not pull any punches for me, who told me that I wasn't a candidate for surgery, chemo, or radiation. I received none of that. But that allowed my immune system to be built up and to be receptive, I believe. And, I'm a novice. I'm like the guy in the Bible. I was blind, but now I see. So I'm living at this place of being able to internalize that, and also to tell other African-American men, you have to have an oncologist that's walking with you, that you can trust. And if they tell you that you're not a candidate for Provenge, I personally, since we're on the unscripted version right now, get another oncologist. Dr. Sorce said it well. It's an expensive drug, but every year I'm alive, guess what? It gets cheaper and cheaper.
I want to just echo again what Mr. Jones is saying about diet. My father, he's been hormone sensitive now for over 10 years. The average person's 4 years or less. And he just changed his diet completely too. Your immune system, if you're not, it can work to its full potential if you're not constantly assaulting it through your environment and through food. So give your immune system a chance to work. Yeah.
Well,
Because of what my wife Janet has instituted, she actually started chronicling also our journey, and that chronicling morphed into a book. It's called The Trial of Stage 4 Prostate Cancer, sold actually all over the world on Amazon. But she did a chapter on antioxidants. And I do a cocktail every morning of raspberries, strawberries, cherries, blackberries, blueberries, those antioxidants that come into your body and that detoxify your body. So in turn, with the fighting agents that I have that are camped inside of me, sort of like, when we go to war and when we went to Vietnam, we had to learn how to fight differently. So we got into guerrilla warfare. Well, that's what Provenge is like. Provenge comes and they camp out, and then they look for wherever the uprising is, and they can put it out. But prior to that, your immune system can't see it. And this is all I know as a layman. This is all I know. But for me, I have a lot of warriors inside of me fighting.
Yeah, absolutely. Well, Dr. Sorce, Mr. Jones, I can't thank you enough for spending a little bit of your evening with us, and to your partner in life and your caregiver, and to all of the caregivers out there, it's very clear how important your role is in a prostate cancer. We don't love the word journey, but experience, but just so important in the caregiver role. So just a little quick shout out to all of our caregivers out there. We see you and we need you, and thank you. Go ahead.
Before we go off camera, can I invite my caregiver?
We would love to see her.
Okay. Because she was in hold waiting, and I know we've kind of gone over, but I didn't know how long we'd be. But if it were not for this wonderful, young, beautiful lady of 44 years, I would not be here.
Hello, how are you?
Hello, welcome. Thank you for all you do.
You're welcome. I think I met you at the Zero Summit.
We are longtime friends now, 3 months.
Absolutely. Absolutely. Well, it's nice to see you again.
You too. You too. Well, thanks for popping on, Mr. Jones. Thank you. Dr. Sorce, thank you. I want to thank Dendreon, our amazing partner and sponsor of this event, and many of our educational and advocacy efforts. So thank you so much. And as we close out our webinar, just another quick plug for our survey. Again, we read your responses. We read your other topics for the future so that we can make our programming everything that our patients and caregivers need it to be. So with that, I want to thank you once again and wish you all a wonderful and healthy and safe evening.
Thank you.
Good night.
Thank you.